it's less sensitive to the position of the force vector. It doesn't really rotate. But if you give a force onto incisor segment, it's very sensitive function of the position of the force vector. You'll be killed very well. So presence of the level arm is really essential when it comes to incisor and segment control, which will be discussed later in this afternoon by Professor Young-Chul Park. But when it comes to more like distalization or protraction, you can try level arm or not, but the resultant type of tooth movement will not be very critical, less sensitive. I'm going to talk about this maybe tomorrow afternoon, all right? It all depends on the, first, your segment, target segment, shape of the segment, and the way how the segment is arranged or aligned. That determines the sensitivity of the pattern of movement according to the force vector. Okay, that's it, but I will give you more explanation tomorrow. Okay?
Actually, I have a question.
Yes.
When you have a case of the four incisor did you segment it or did you use a total arch wire?
Oh.
If you use segmented, I can understand it moves. But if you have a total arch wire, the center of the system is not there, it's somewhere else.
Exactly. So her question is, when you try artificial, intentional occlusal plane tension correction for 4 incisors or 6 incisors, is it better to use continuous arch wire or segmented arch wire? Okay? So that was a question. What is your answer? Continuous arch wire is always something like safety device. It prevents any unintentional, undesired movement from happening. So it's a safety device, but on the other hand, it interferes with the segmental movement. So if you are very confident about your force vector, maybe I will discuss it sometime day after tomorrow. If you are very confident with your force vector, it is always good to use a segmented arch wire, because your tooth movement is not interfered with the presence of the posterior arch wire or something, right? But if
so would you recommend segmented or total arch wire?
Segmented for the most part. Okay. Any other questions? So that's it. Please think about it, and get back to the room by 3:30. 3:30. Is that okay? All right.